Well, it was difficult for me because to apply for health insurance, either you have to pay for it at your job, or you would have to get Medicaid, and I wasn't eligible for that, and I wasn't working at the time. I said before, I am a recovering alcoholic. I need the insurance. I had a problem before because I couldn't afford medication. And thank God that these doors opened up for me. With my thyroid, my blood pressure. I didn't know what was going on with my health. And after my stroke, I had to go to therapy, and Lady of Lourdes really helped me. I was getting dizzy, very dizzy, losing my voice. I didn't know what was going on. Sometimes I would get angry, sometimes I would be happy, and my blood pressure would go sky high. So I got some blood work done, and I was diagnosed with hyperthyroid. Because I was just making it. But now, since I've got the insurance this past year, it's been really good. The thing is, I don't have to worry, that worry that I used to have about, wow, I have to get medication. Wow, I wonder how much the doctor's gonna charge me. And all these things, I don't have to, I'm so grateful. You don't know the alivio, we call it in Spanish. You don't know the feeling that it takes away, the stress. I don't have to go through that, you know? Knowing that I have insurance. Really, I don't know what I would do without it, really. I go to meetings, so I've really let it out there, and everybody's like, "What? Can you help me?" Because and then I'm famous. I came on TV, so I have a lot of people in my neighborhood. I was born here, so I know half of Camden. So everybody's like, "Hey, there goes the guy from the insurance." I'm just getting myself together. So yeah, you can go file for the insurance. They're afraid because, again, they're low-income people like myself, and they think when you say insurance, they say, "Oh, well, I can't afford it." And I said, "Yes, you can. You know, they have plans you can afford." And I said, "They pay everything, so you don't have, they'll start giving me all this kind of medication." I said, no, you can afford that because, you know, they pay for the medication." And I explained to them so they don't be so scared, especially recovering people on recovery. We have a lot of them in Camden. So, you know, I do suggest it, we're in my home group, that we all need this insurance. We all need to get insurance, you know, because depression, a lot of people get depression, a lot of people go through a lot of anxiety and all that stuff. And this is what this insurance helps you. You don't have to be the one less thing you have to worry about, you know? Yeah, a lot of people just be afraid because they don't know. They're the unknown. The easier thing for them is to just go apply for welfare and to get Medicaid through them, because that's like a norm for everyone. "Oh, I'll get Medicaid. Well, guess what? Now there's an insurance company. You don't have to go through Medicaid that you can get that covers us just as much or more." Now I don't feel that. I got my insurance company. First thing is I got this insurance. Okay, do you accept it? And so far, no one has said, "No, we don't accept that insurance." You know, I moved from pharmacy. Because of this. You know, you can get a local pharmacy. It's a good one, family pharmacy. You know, and I feel comfortable. I don't like to be jumping around. I like to keep, you know, my doctor, have a relationship. I trust him. This is my health. My life is just starting at 51. I'm more confident. I want to go back to school. You know, my wife says, "Oh, you want to go back to school? You're no man, you're a grandfather." I said, "No, I'm not. I'm going back to school. I want to have a big business. You know, I do a little handyman business. I got a little handyman, but I want to do construction. I want, you know." I feel like I'm just starting off, and this is what helps. This is what's helping me. That I can deal with a situation that I've always been afraid of for many years. I was afraid of going to the doctors and finding out what's going on, because then I wouldn't have nowhere to take care of it. But this is a big thing for me. It's like a miracle.